If somebody has to wipe my bum, I'm out of here, right? I tend to only give psilocybin to my own patients who I know very well and I have a relationship with already. But even those people, we go through, what is your past trauma history? Because people with trauma, it all may come up in the medicine. So we have to be prepared for that. And they have to be, consenting to that potentially happening. We want to make sure they don't have bipolar disorder or history of schizophrenia, because some people can get psychotic. We exclude people with those kinds of disorders of thinking. Borderline people have difficulty navigating a psychedelic. I think they need to have a really good therapist to be working with them. So I'm not I have therapists that work with me, but that person has to be committed to having ongoing therapy, which they would have to pay for. So we make sure that they're not taking medications that would interact with psilocybin. So it is a process. It's a medical intake, psychological intake, and then the preparation is really learning techniques of self-regulation, being able to be mindful of what's happening in your body, understanding the difference between pain and suffering, or understanding what suffering is. And this is the most important thing. It is self-compassion, because this is the thing, people with existential distress are often have very low self-compassion. If they can't be productive, they're useless, they're wasted space. And so when we feel compassionate about ourselves, we can be compassionate about the situation we're in, and then, we are actually more graceful in accepting care.